morning, Mr. Smith. My name is Lori. I'm your nurse. Can I see your name band? Great. Can you tell me your name and your birth date? Great. The doctor wants us to irrigate your wound this morning, so the first thing I'm going to do is kind of clean off your table back here. Just clean that because we are going to be setting up some supplies on this area. Wash my hands. And then I'm going to be putting on my gloves. We're going to be taking Mr. Smith's old dressing off first, and then we'll be setting up our sterile field for irrigation and for getting a culture of his wound. I'm just going to expose the area here, and we did medicate Mr. Smith about a half an hour ago because he does have a deeper wound, and so that pain medicine should be kicking in. I'm going to kind of hold his skin kind of taut when I pull it away from his skin, kind of all the way around. This dressing is actually taped in a picture frame manner. And so we're going to kind of just loosen that tape up, kind of holding his skin. And we always want to take away the dressing away from their face so that they don't see it, even though this is on his backside. So we're going to kind of take that off. We're going to look at the coca, color, odor, consistency, and amount. Again, we're going to take a look at that. If it was pourable, drippable, squeezable, or flakeable, we would put it in a biohazard bag. If it doesn't meet those qualifications, then we can just throw it in a garbage bag. We're going to take off the next layer, and those are 4x4s. We're going to again look at the coca and note that for our nurse's note later. Then I'm going to take off my gloves, and I'm going to wash my hands, and then I'm going to be setting up my sterile supplies and my clean supplies, depending which one we're talking about. The first thing I'm going to do is take a basin and put it underneath the area to catch the irrigation solution. I'm going to look at my irrigation solution, which is sodium chloride. It expires November of 2013. I'm going to have my kit here, which has a syringe that has a wound irrigation system to help prevent splashing. Next, I'm going to set up my supplies. I need a 4x4 to drain to dry my wound. Then I'm going to actually culture the wound, and I'm going to measure the wound, and then we're going to be putting on another 4x4 and a ABD dressing at the end. I have tape here also. The first thing I'm going to do, because this we have to set up last, is go ahead and open up my sterile packages. We've looked at the expiration date, making sure not to contaminate them when we open them. We're going to open that one up. We're going to open up our cotton tip applicators for when we measure. And that's okay, we're going to have clean gloves on anyway, so. We're going to open up another 4x4. And we're going to be opening up our ABD last. Okay. And lastly, we're going to take a last look at our sodium chloride. It expires November of 13, and we're going to take that cover off. I'm going to just put that off to the side. We're going to open up our wound irrigation system. I'm going to just take that cover off there. And then we're going to end up kind of just dumping it off to the side so that you're not actually reaching into the kit. And then I'm going to take and I'm going to pour some solution right on into the kind of the basin right here. Okay. Okay, now I need to put on gloves, so I'm going to just put the sterile end into the solution, and I'm going to come around my sterile field, making sure not to reach over, and I'm going to put on my gloves. Okay, and now we're going to draw up our solution. So you take, it's just like a regular syringe. You actually, there's a one-way valve in there that actually allows the fluid to come in, and then it's going to shoot it out, and there's a splash guard on there. So we're going to just switch hands here, And we're going to come over to the wound, and we're going to just go from areas of clean to dirty, back and forth, making sure not to touch the external skin, back and forth. And this is a wound that is being treated with antibiotics. So when we culture, we want to culture the areas of clean granulation tissue. Again, we're going to continue to irrigate back and forth until it runs clear. So how much ever that is. And again, when we assess the wound, we're looking at all the different areas. I note that there's areas of red granulation tissue in there. There's also areas of purulent drainage. Good. So let's say that now is running clear. So I'm going to just set this on the side. The next thing I'm going to do is actually dry the wound. So I want to pick up the 4x4 by the corner. So I'm going to pick it up by this corner and the opposite corner. And then I'm going to bring this corner in and this corner in. And we're going to just put it right in the middle of the wound, just like that, to dry the wound. We'll give it just a little bit to absorb the irrigation. And we'll pull that out. Okay. Now when I look at the wound, I'm going to just take a look at the wound. And again, looking at areas of clean granulation tissue, that's where we want to take our swab from for our culture. Also note that there is some undermining that takes place, almost like a lip where it goes underneath further. There is also an area that is a tunneling area, like at 2 o'clock. Again, the head is always noon and the tailbone is always 6 o'clock. So when we look at the wound at about 2 o'clock, there is an area that actually has a tunneling area there. So the next thing we want to do is actually culture. So we're going to take our culturette tube. And again, we would have a label on here that was printed out. And we're going to just take it. And again, because this is a treated wound, we're going to go over clean areas of granulation tissue. So I'm just going to kind of roll it across. Good. And then I'm going to put it back in here, taking note not to get the outside of the culture tube. This one has an ampule on the bottom to break, so as soon as you put it in there, you would crush it and you kind of hear it. Okay, we're going to put that off to the side and we'll show you the biohazard bag later. The next thing we're going to do is actually measure the wound. So if you have a measuring guide, we're going to measure it in centimeters, and you want to always go from head to toe first. So we're going to go from here and make sure not to touch the wound. So here it's about 5.2 centimeters. And then we want to go side to side. And here it is about 5.2 as well. So again, that's the length by the width. And then what we want to do is measure the depth and the tunneling. So the first thing I'm going to do is, when you measure the depth, is if you come in and kind of put it to the side and kind of go down, you sometimes can get some of the exudate or the secretions on your cotton tip applicator, and then you would come back and you would put it next to your strip, your measuring strip, and you could see how many centimeters that is. So again, it doesn't have any color, so it's hard to do, but again, you would put it next to it so you could measure it. So that would be the depth. The next thing we're going to do is measure the tunneling. And here it's really kind of a guesstimate. You're going to find the tunneling area. You're going to go in until you can't go in anymore. And you're going to kind of eyeball to see where exactly on the cotton tip you are, in addition to the secretion, the wetness of the cotton tip applicator. And we're going to come over and do the same thing. We're going to put it right next to the measuring strip and see how deep that tunneling area is. Okay, good. And then we're going to put on our dressing. So the first one we're going to put on, we're going to use what we call the no-touch technique. The no-touch technique is to pick up 2 4x4s without touching the side that's actually going to the wound, which is this side. So we are going to put this right over the top of the wound using the no-touch technique. The next thing we're going to put on is our ABD dressing, And so we're going to open that up. Again, not touching the side that goes on there. We're going to put that over the top. Okay, and we're going to use that same technique of picture framing. If you keep your gloves on when you tape, you need to keep this roll of tape in that patient or resident room. So again, I have my gloves on, so this tape is now, this patient's tape will stay in here his whole stay. And I'm going to rip that. We're going to just put that on, again, covering all aspects, kind of picture framing it. And again, this is kind of hard because of the area that it's in, but you do the best that you can. Okay, good. So we've put the new dressing on. We will take this away. We will probably change the Chuck's pad. And then we would come over here and we could put our sample, our culture, in a biohazard bag. We can put that in there. Typically there's paperwork that always needs to go along with the sample. That paperwork generally gets put in a separate pocket here, and we would ship this off to the lab, making sure that we have all of the information that they require. Generally the site, the time, who took the culture, and if there was any other specifics that the doctor wanted us to note. Then we would clean up all of our supplies. We would make sure that the patient is in a comfortable position, and we would lower his bed and make sure the call light is within reach. And we would go ahead and we will label our irrigation solution and make sure that the Chuck's pad, because again, the Chuck's pad does get wet when we irrigate, that we would change the Chuck's pad. And that's how you irrigate and culture a wound.